Globe. We are in New York for the UN General Assembly. I'm here with Jim and I'll ask him to introduce himself.
Hello, good morning. Jim Campbell. I'm the Director of the Health Workforce Department at the World Health Organization.
All right, Jim. So the UN Commission was launched yesterday. Can you tell us more about it? Give us an update.
Indeed, yes. We've spent the last 9 months at the request of the Secretary General with the High-Level Commission on Health, Employment and Economic Growth to come together and look at the issue of the challenges in the health workforce as part of the agenda for sustainable development.
Oh, fantastic. And what does this mean for mothers, for midwives, for young people as well as adolescents?
So the Commission has put out 10 recommendations. 6 of those are looking at the challenges around a global mismatch in the supply, demand and need for health workers to 2030. 4 of those are then around the enabling actions we need to take, and then a 5-year implementation, some immediate actions that need to be driven forward. So what does it mean for health workers?
Yeah.
This presents an opportunity to redefine the discussion and the debate. For many years now, there's been a consideration that health workers are a cost. The Commission reminds all of us that health workers are actually an investment. And that opens up a new dialogue, a new debate on how do we ensure the education, the competencies development, the decent working conditions for health workers. And so for them, it's a set of evidence, it's a political message to enable them to have discussions at the local level in their health facilities with their health managers, with the providers, to actually say, okay, how can we make a difference collectively using this evidence, using this advocacy to ensure that we're promoting universal health coverage. And so for women and young women, for adolescents, the connection with the Secretary General's approach in terms of the Women, Adolescent, Child Health Strategy, this will have an impact on ensuring that we have the number of workers with the right skills in the right places to ensure that they can access quality care. For youth, there's 2 central messages in the report. First of all, that our health workforce around the world is primarily female, and that is likely to grow. So we have a particular benefit in offering young women and women throughout their career pathways an opportunity to work in the public sector. And so we can do a very positive benefit. And we heard from the Prime Minister of Norway yesterday, who was emphasizing this message about women's participation in the labour force, their economic participation. And so this isn't just about SDG 3 on the health workforce and the health care, but actually the issue of gender equality, women's participation, decent working conditions, the economic development of our society. So it's a cross-cutting SDG agenda. Youth, one of our commissioners is Dr. Ala Mourabit, who represents the Voice of Libyan Women, and herself a young paediatrician who's brought this youth dynamic to the work of the Commission. And in terms of particular how we ensure the engagement of youth at the global level, but also at the national and regional level to be participating in these discussions, how they also are going to have an opportunity to engage in the health workforce. We in particular reference some of the changes in the demographics around the world, and how the opportunity to create jobs which young people may be interested in, to bring them into a career in the health service and get them engaged will be a huge opportunity there. So yeah, Dr. Mourabit has been a real champion of the youth agenda on the Commission.
Oh, that's fantastic. I love the fact that there is an integration of young people and other key populations within the Commission. Thank you so much,
No,
Jim,
thank you very much
for joining us.
We wish Girls Globe the best. Continue your great work.
Oh, definitely. So that was Jim from the World Health Organization Health Workforce. Girls Globe signing out. Thank you.